My name is Kaylee Gray. This is my second presentation for Biology 1030, Pathophysiology. These are my notes. And I'm going to be talking about lymphatic syndrome. So some general clinical manifestations of lymphatic syndrome. Kind of one of the most common is edema, and we call this lymphedema. Usually it is in a limb that's either been affected by something that's affecting the lymphatic system, specifically in that limb, or you may see generalized bilateral edema in the lower limbs. Usually we refer to that as lymphedema. You may see swollen or painful lymph nodes, especially under palpation. We most commonly see this in a clinical presentation in maybe a patient who has the common cold, might come in and complain of some pain and tenderness here in the neck, and those usually come from swollen cervical lymph nodes. We also may see an altered immune response, depending on what's going on with the lymphatic system and what's affecting it. So lymphatic syndrome is different than other cardiovascular syndromes, although you may see some similar presentations, especially with something like peripheral venous disease or venous hypertension syndrome. You see swelling and edema in the lower legs with both of those things, and it may present as lymphedema, and in fact it is lymphedema. But what's causing that is not necessarily a blockage directly in the lymph node itself, but that usually comes from a disrupt in the valves in the venous system, usually leaking valves in the venous system in the lower legs, and that presents as edema. We also see a lot of edema in congestive heart failure patients or patients with heart failure syndrome. Usually that is related to fluid imbalances. That's a mechanical problem where the heart is not pumping blood as well as it once did. And so you end up with fluid imbalances and backup and edema in the lower legs. There's also other cardiac syndromes that maybe are not so similar to lymphedema or to lymphatic syndrome, because they're related to mechanical issues with the heart. So you've got things like cardiac valvular syndrome, you've got coronary syndrome, things like that. Those are all mechanical issues with the heart, not necessarily related to the lymphatic system or lymphatic syndrome at all. So when it comes to common diseases of the lymphatic system and that cause lymphatic syndrome, usually they're related to three things. You've got blockages, you have infections, or you have cancer. Now, if you've got a blockage in a lymph node or in a lymphatic duct, you end up with lymphedema. And lymphedema is where you basically have edema and additional fluid and swelling within the affected limb or limbs. Usually when this is related to venous disease, as we talked earlier, we see it in the lower legs. However, another really common presentation of lymphedema may be in a patient who has cancer and either has had lymph nodes removed in an area or has had radiation treatment in an area. What happens is you, like, say for instance you have a woman who has survived breast cancer. She's had lymph nodes removed in that area. She's likely to have lymphedema usually in the upper arm. You might see it on the chest wall, the shoulder, down in the arm of that side that was affected by the breast removal and the lymph removal. Also, if she's had maybe some radiation on that side, the lymph nodes are still intact, but she's had radiation, and that's affected and caused blockage and buildup in the lymphatic system there. You may have a lymphedema on the affected side as well. Also, speaking of cancer, we see metastases into the lymph nodes, which may cause the removal of lymph nodes, and then you might have lymphedema in that affected side. You also have cancers that affect specifically the lymphatic system. These are cancers of the white blood cells that we know of as lymphomas. Usually two forms, Hodgkin's lymphoma and non-Hodgkin's lymphoma. The difference between the two is the type of lymphocyte and what type of white blood cells they're actually affecting, and how those white blood cells back up in the lymphatic system and cause blockages. So the other thing besides cancer and besides blockages in the lymphatic system are infections. The lymphatic system plays a key role in the immune response to things. So when you have infections within the lymphatic system, you have something called lymphadenitis or lymphangitis. These can cause swollen lymph nodes. Again, we talked about the common cold earlier. We might have some pain and tenderness in here. You might have them in here. Usually that's coming from an infection that's causing inflammation in the lymph node itself. And lymphadenitis comes when you have an organism that's spreading throughout the lymph system and causing some of that inflammation and infection. So while lymphatic diseases can look quite similar to other cardiac syndromes, usually what is bringing them about, because they're tied together, could be similar, but they also could come from very different causes that are just manifesting in very similar ways. This has been my presentation on lymphatic syndrome. Thank you.